Good morning.
Good morning.
My name is Ginger. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Kata White, 215-19XX.
Excellent. So I'm going to pull this curtain for privacy. And I'm here today to do an examination of your musculoskeletal system in your lower extremities.
Okay.
Do you have any questions about that?
No.
All right. And I don't have any additional equipment that's needed for this assessment. Can you please put this gown on? Wonderful. And are you having any overall pain?
No.
And I have a couple questions that are going to be a little more specific. So, have you been having any pain in your joints?
No.
And have you noticed any stiffness or limited range of motion within your joints?
No.
And have you been experiencing any pain in your muscles?
No.
Okay, great. So I'm going to start with you hopping off. Be careful, you have socks on. And I'm just going to watch you do some walking, versions of walking for me.
Okay.
So if you could take about 5 to 6 steps forward so I can just watch. And then can you come back on your tippy toes? And then if you want to go ahead and walk away from me again on your heels. And the last one, if you could walk back doing a tightrope motion where you're going to put your heel to your toe. Great. Okay, if you could, actually, you know what? Let's have you continue standing for just a second. So your gait was smooth, it's stable, your posture is erect, and I didn't notice any abnormal feet locations while you were doing that. So that all looks wonderful. Okay, so moving on to your spine, I'm just going to have you turn face the window for a minute. So with this, I am going to do an assessment of your cervical spine down to your lumbar. I'm going to focus more on your lumbar in this particular assessment. So I don't, upon inspection, I don't visualize any scoliosis, kyphosis, and specifically any lordosis on your back. So I don't see any visible deformities. Your shoulders have symmetry, so there isn't any concern about size or the asymmetry in terms of that. And I don't see any erythema down your spine. So now I'm going to palpate your back. And first I'm going to start with palpating the spine. So do you have any pain or tenderness as I'm doing that? Okay, and then I'm going to do your muscles, paraspinal muscles, right all the way down to the back. Any pain or tenderness with that? So I didn't notice any changes in warmth in your temperature and continue to have good size symmetry, and I don't notice any deformities. So now if you can turn to the wall, we're going to do some motions for your lumbar spine and see how that is. So the first one we're going to do is bending forward. This is flexion. If we could stand up straight, this is extension, and then lean back comfortably, that is hyperextension. Then I'm going to have you turn, keep your hips straight, and then I want you to turn your upper half towards the window. This is rotation left, and then if you could turn it towards the wall, this is rotation right. And then if you put your hands down at your side, I want you to lean your body to the left, that's lateral bend left, and then if you could lean your body to the right, that is lateral bend right. We're good? Excellent. So now we're going to test strength for, no, we're not going to do strength on your lumbar spine. Pardon me. So now I'm going to actually have you hop up onto the bed, and I'm going to have you lie down to do this assessment. So starting with your hips, I'm looking to see upon inspection, do I see redness? Is there any change in size? And there's any asymmetry? And do I notice any deformities in your hip area? I don't notice any of those things. So now I'm going to palpate. So when I palpate your hips, tall, my dear, do you have any pain or tenderness when I'm doing your hip joints? No. Good. All right. And I didn't notice any changes in size, symmetry, masses, increased warmth, any deformity in your hips when we do that. So we have 6 motions we're going to be doing with each of your hips. Okay. So I'm going to help and explain, and then you'll do the same thing on the opposite.
Okay.
Okay. Just because of the legs. So first I'm going to have you straighten your leg and lift it up as best you can. That is flexion. Bring your leg all the way back down straight. This is extension. If you were standing, I could have you kick your leg backward, and that's hyperextension.
Okay.
Okay. So again, we just lift it all the way up. So we have flexion, down is extension, and then what would be hyperextension. So there's the first two. The next one, I want you to take your leg and kick it out towards me. Great. And then pull it back in. So outward is abduction. Back to the midline is adduction. If you could do the same thing on this leg, all the way out. So we have abduction, back center is adduction. And then the last two is going to be internal and external rotation. So if you could bend your knee up, I want you to let your knee fall out towards me. That is external rotation, and then cross over. That is internal rotation. Great. Put that leg down. Now we're going to bend this knee up, and I'm going to have you go outward is external rotation and then internal rotation. Great. And straighten your leg. Any pain you're doing? All right. So now we're going to test strength on all of these. Okay. So can you, repeating those motions, lift up? Great. Pull down. Okay. Lift up. Pull down. All right. So now I want you to keep your knees straight. I want you to kick your legs outward. Good. And then inward. Wonderful. So we have 5 out of 5 strength in those 4 motions so far. If you could bend your knees up. Yeah, you could do both. It doesn't, you're right. Put that one down. Just make so people can see what we're doing. Can you not kick out, bend out. Good. And pull in. And then I don't really need to be on this side, but push out, pull in. Good. So 5 out of 5 strength for all of them after mentioning the first 4. So those are your hip motions. Now we're going to move to your knees. So looking at your knees, and I don't see any redness. They are the same size. They are symmetrical. I don't see any deformities. So now I'm going to palpate them. So palpating your knee in general, no pain or tenderness. Okay, good. So there's no difference in warmth, and again, size, symmetry are the same, and I don't feel any deformities under my hands. So we have 2 movements that we're going to do for the knee. So if you can take this knee and bend it up towards, great. So that is flexion, and then straighten it out is extension, and then on this side, so we're going to do flexion and then extension. Wonderful. So I'm going to have you sit up to do the strength. Just a little bit easier. So to do this, I want you to push out, pull back, push out, kick out, and then pull back. Great. So you have 5 out of 5 strength in your knees. So moving down to your ankles and looking at your ankles, I don't notice any erythema on them. I don't see any deformities, and your size of your ankles and you are symmetrical. So everything looks good with that. So now I'm going to palpate. So just tell me if you have any pain or tenderness in the joint. Good. So the warmth, there's no increased warmth. It is the same bilateral, and I didn't feel any deformities. I didn't feel any masses, and size and symmetry is the same. So now you have 4 movements for your ankles that I'm going to have you do. So the first one is I want you to point your toes to the ceiling. So that is dorsiflexion. I want you to point them down, point perfect. That is plantar flexion. Bring them back to midline. And then I want you to pull your toes inward is inversion, and then flip them out is eversion. Great. So now let's test some strength. So I want you to pull up towards the ceiling. Great. Press down on a gas pedal, and then pull inward, and then pull outward. Great. So you have 5 out of 5 strength in all of those particular areas. And then the last is the lower portion of your feet and your toes, looking for erythema. If I see any deformities, size, symmetrical, it all looks good. There's no abnormalities noted. And then I'm going to palpate. So just tell me if you have any pain or tenderness. Any pain or tenderness on this side. Good. So I don't feel any masses, no deformities, and size and symmetry continue to be the same, and there's no increase in warmth. So I'm going to just have you curl your toes and then and go ahead and open them. Great. All right. So you have 5 out of 5 strength in your toes. That looks wonderful. But because there's another movement of your body that we didn't assess, I am going to go up to your elbows, and I want you to do 2 movements. So the first is keep your elbows at your side and put your hands in this position. This is called supination. And then I want you to turn your hands over, and this is called pronation. Right? And I'm just going to test strength in those 2 movements. So either way to start, and I'm going to put my hands, try to turn your hands over. Good. And then put your hands in pronation and have you turn. And you have 5 out of 5 strength in both motions for your elbow. That's where that's coming from. So the last test we're going to do is I'm going to have you lie down. And we're going to do the straight leg test, also called Lesiegs. And in this case, what I want you to do is keep your knee straight. And I'm going to help you just to start, but I'm going to have you, I'm going to lift your leg up towards the ceiling. Any pain in your back? No. Okay. And then do it on this leg. Keep this knee straight. And any pain in your back when you do this? Great. That's it. So I have you sit up. Do you need help? So I didn't find any abnormalities while doing this particular test of your musculoskeletal system on the lower extremities. And if I did, I would let the provider know. But as I said, I didn't find anything. So I'm going to go ahead and document my findings.
Okay.